Hello, and welcome. Today we're diving into the world of heart health to explore a condition called atrial tachycardia. We'll unravel what it is, what causes it, how it affects your heart, and what can be done about it. So, let's get started on this informative journey. Atrial tachycardia, often abbreviated as AT, arises from a variety of sources. It frequently stems from underlying heart conditions such as high blood pressure, coronary artery disease, or heart valve problems. Chronic lung diseases like COPD can also contribute. Lifestyle factors play a role, with excessive alcohol consumption, smoking, and high caffeine intake acting as potential triggers. Sometimes AT can occur even in individuals with otherwise healthy hearts, making the exact cause more challenging to pinpoint. And, of course, certain medications or electrolyte imbalances can also increase your risk. To understand atrial tachycardia, we need to look at the heart's electrical system. Normally, the sinoatrial node, or ASA node, acts as the heart's natural pacemaker, sending out regular electrical impulses that cause the atria to contract in a coordinated manner. In AT, however, an abnormal electrical circuit forms within the atria. This circuit bypasses the SA node and generates rapid, repetitive electrical signals. These signals cause the atria to contract much faster than normal, typically between 150 and 250 beats per minute. This rapid atrial activity disrupts the normal sequence of heartbeats, leading to a faster overall heart rate and potentially compromising the heart's ability to efficiently pump blood. The exact prevalence of atrial tachycardia is difficult to determine, as many individuals may experience it infrequently or have it misdiagnosed. It's generally considered less common than other types of supraventricular tachycardias, such as atrial fibrillation or atrial flutter. While AT can occur in people of all ages, it's more frequently observed in adults and older individuals, particularly those with pre-existing heart conditions. The underlying conditions that contribute to AT, such as hypertension and coronary artery disease, become more prevalent with age, indirectly influencing the incidence of AT. The symptoms of atrial tachycardia can vary significantly from person to person. Some individuals may experience no symptoms at all, while others may find the symptoms quite distressing. Common symptoms include a rapid heartbeat or palpitations, often described as a fluttering or racing sensation in the chest. Dizziness, lightheadedness, and shortness of breath are also frequent complaints. Some individuals may experience chest pain or discomfort, and in severe cases, AT can lead to fainting or near-fainting episodes. The severity and frequency of symptoms depend on the heart rate during the tachycardia, the duration of the episodes, and the presence of underlying heart conditions. Diagnosing atrial tachycardia typically involves a combination of methods. A physical examination, including listening to the heart with a stethoscope, is a crucial first step. However, the cornerstone of diagnosis is the electrocardiogram, or ECG. An ECG records the electrical activity of the heart and can reveal the characteristic rapid atrial rate and the abnormal P-wave morphology seen in AT. In some cases, the AT may not be present during a standard ECG. In these instances, a Holter monitor, which records the heart's electrical activity over 24 to 48 hours, or an event recorder, which can be worn for even longer periods, may be used to capture the arrhythmia when it occurs. Electrophysiological studies, or EPS, which involve inserting catheters into the heart to map its electrical activity, can be used to pinpoint the location of the abnormal circuit and plan for potential ablation therapy. Atrial tachycardia can be broadly classified based on its mechanism and source. Focal atrial tachycardia originates from a single, localized area within the atria. Macroentrant atrial tachycardia involves a larger circuit that travels around anatomical structures within the atria. The type of AT can influence the choice of treatment strategy. For instance, focal AT is often amenable to catheter ablation, while macroentrant AT may require a different approach. The management of atrial tachycardia focuses on controlling the heart rate, preventing future episodes, and addressing any underlying conditions. Acute episodes can be treated with vagal maneuvers, such as the Valsalva maneuver or carotid sinus massage, which can sometimes slow down the heart rate. Medications, such as beta blockers, calcium channel blockers, and antiarrhythmic drugs, can also be used to control the heart rate and prevent recurrences. In some cases, a procedure called catheter ablation may be recommended. This involves using radiofrequency energy to destroy the abnormal electrical circuit within the atria, effectively curing the AT. In addition, addressing any underlying medical conditions, such as hypertension or heart valve problems, is crucial for long-term management. While it's not always possible to completely prevent atrial tachycardia, several lifestyle modifications can help reduce the risk. Maintaining a healthy weight, eating a balanced diet, and engaging in regular physical activity are beneficial for overall heart health. Limiting alcohol and caffeine intake and avoiding smoking can also decrease the likelihood of developing AT. Managing underlying conditions, such as high blood pressure and diabetes, is essential for preventing heart-related complications, including AT. Regular checkups with your doctor can help identify and address potential risk factors early on. The prognosis for individuals with atrial tachycardia is generally good, especially with appropriate treatment. Many people can effectively manage their condition with medication and lifestyle modifications. Catheter ablation offers a high success rate in curing AT and eliminating the need for long-term medication. However, the long-term outlook can be influenced by the presence of underlying heart conditions. Recent research has focused on improving the accuracy and effectiveness of catheter ablation techniques, as well as developing new antiarrhythmic drugs with fewer side effects. Studies are also exploring the role of genetics in predisposing individuals to atrial arrhythmias, including AT.